Have you ever heard about polycystic ovarian syndrome? This is our topic of conversation today. Polycystic ovarian syndrome, or PCOS as it is commonly known, is a common hormonal disorder that predominantly affects women during their reproductive years. Picture this. Every month, a woman's ovaries produce tiny little sacs called follicles. These follicles are supposed to mature, release an egg, and voila, that's ovulation in action. However, in the world of PCOS, this doesn't always go as planned. In PCOS, these follicles may not mature as they should. Instead of releasing an egg, they might partly mature and bunch together, forming small cysts on the ovaries. But that's not all. PCOS isn't just about cysts. It's a hormonal disorder, which means it's about an imbalance in the body's chemical messengers, hormones. Now let's talk about androgens. These are typically referred to as male hormones. But did you know that women also produce them? Yes, they do, but in the case of PCOS, the body goes into an overdrive mode and produces more androgens than necessary. Why is this a problem, you may ask? Well, androgens are like that friend who doesn't know when to stop talking. They interfere with the development and release of eggs during ovulation, making it difficult for the ovaries to function as they should. This leads to irregular periods and can even lead to infertility in some cases. The excess androgens can also show up in other ways, like unwanted hair growth, acne, and even thinning hair. It's like a domino effect. One imbalance leads to another, and another, causing a cascade of symptoms that can vary widely from woman to woman. So that's what polycystic ovarian syndrome is in a nutshell. It's a complex condition, a hormonal disorder that can throw a wrench in the works of a woman's reproductive system. But what causes it? The exact cause of PCOS is still a mystery, but we'll delve into what we do know in our next segment. Stay tuned. Ever wondered what causes polycystic ovarian syndrome? While the exact cause remains elusive, several factors seem to play a significant role in its development. One of these is high levels of insulin. Insulin is a hormone that controls how the food you eat is changed into energy. If your body isn't responding to insulin as it should, insulin levels rise, and this may trigger your ovaries to produce too much testosterone, a male hormone that can lead to PCOS. Another potential cause is low-grade inflammation. This term refers to your body's immune system's subtle, chronic activation, which can stimulate your ovaries to produce androgens, again leading to PCOS. Lastly, heredity plays a part. If your mother or sister has PCOS, your chances of having it are higher. However, remember these are only pieces of the puzzle, and the full picture of what causes PCOS is still coming into focus. Now that we know what causes PCOS, let's discuss who it affects. Polycystic ovarian syndrome isn't selective. But who does it commonly affect? Well, PCOS primarily impacts women in their reproductive years, typically those between the ages of 15 and 44. It's a condition that doesn't discriminate based on age within this range. Whether you're a teenager just starting your period or a woman in her early 40s, PCOS could be a part of your life. Interestingly, it's estimated that up to 20% of women of reproductive age may have PCOS, but a significant number of these cases go undiagnosed. Why? Because the symptoms of PCOS can be mild at the beginning. Many women may not even realize they have it until they encounter difficulties with pregnancy or experience irregular periods. It's a stealthy condition that can quietly impact a woman's health. But with knowledge and awareness, we can bring it into the light. Now, let's move on to the signs and symptoms of PCOS. How can someone tell if they have polycystic ovarian syndrome? It can be a bit tricky as the signs and symptoms of PCOS can vary widely from woman to woman. However, there are some common indicators that could suggest the presence of this condition. One of the most prominent signs of PCOS is irregular periods. These can range from infrequent menstrual periods to prolonged cycles that are more than 35 days apart. So if your calendar is looking a bit chaotic, it might be worth talking to your healthcare provider. Heavy bleeding during periods is another potential symptom. This is because the lining of the uterus can build up for a longer period due to irregular menstrual cycles, leading to heavier than normal bleeding when menstruation does occur. Excess hair growth, known medically as hirsutism, can also indicate PCOS. This can manifest as unwanted hair growth in areas such as the face, back, and chest. This is due to an overproduction of male hormones which PCOS can cause. If you've noticed an increase in acne or oily skin, this could be another sign. Again, this is down to those pesky male hormones that can be overproduced in women with PCOS. Weight gain, particularly around the waist, and difficulties losing weight are other common symptoms. This can be extremely frustrating, especially when it feels like you're doing everything right, but the scale just won't budge. Lastly, fertility problems can be a sign of PCOS. Many women with PCOS may struggle to get pregnant due to irregular ovulation or failure to ovulate. It's important to note that not all women with PCOS will have all these symptoms. Some might have only a few, and they can vary in severity. So if you're experiencing one or more of these symptoms, it's worth having a chat with your healthcare provider. But what happens if PCOS is left untreated? That's a great question, and it's what we'll be diving into next. Stay tuned. What are the side effects of polycystic ovarian syndrome? This is a question that many are curious about. When PCOS goes untreated, it can lead to a myriad of side effects that can significantly impact a woman's life. One of the most common side effects is infertility. This is due to the irregular ovulation or failure to ovulate associated with PCOS, making it more challenging for women to conceive. It's a heartbreaking reality for those who dream of starting a family. Next, we have the metabolic syndrome. This is a cluster of conditions that occur together, including high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. The presence of these conditions increases the risk of heart disease, stroke, and diabetes. Sleep apnea is another side effect to consider. It's a potentially serious sleep disorder that causes breathing to repeatedly stop and start during sleep, leading to poor sleep quality and fatigue. Then, there's endometrial cancer. Women with PCOS may have prolonged periods or may not menstruate at all, causing the endometrium or the lining of the womb to grow excessively. This can increase the risk of endometrial cancer. Lastly, let's not forget about depression. The hormonal imbalance coupled with the physical changes can lead to mood swings, anxiety, and in some cases, depression. It sounds serious, doesn't it? But don't worry, there are ways of managing and treating PCOS. What can be done to manage and treat polycystic ovarian syndrome? The answer is twofold: proactive management and targeted treatment. Let's delve into it. The first and often most effective approach is lifestyle changes. Regular physical activity and a balanced diet are crucial. It's not about achieving a runway model figure, but about maintaining a healthy weight to keep your hormones in check. A diet rich in fruits, vegetables, lean proteins, and whole grains can help manage insulin levels, a key player in PCOS. For some, changes in lifestyle might not be enough, and that's okay. This is where medications come into play. Birth control pills often take the center stage in the treatment plan. They can help regulate menstrual cycles, reduce excess hair growth, and even clear up acne. Metformin, a medication typically used for type 2 diabetes, can also be effective in managing PCOS. It helps lower insulin and blood sugar levels, which can, in turn, improve menstrual regularity. In certain cases, when other treatments don't seem to work, surgery might be considered. A procedure called ovarian drilling can be performed. This is where a surgeon makes tiny holes in the ovarian surface to restore normal ovulation. However, this is usually a last resort and is considered only after other treatments fail to bring about the desired results. Early diagnosis and treatment of PCOS are crucial to prevent long-term complications such as type 2 diabetes, heart disease, and even certain types of cancer. It's important to remember that every person is unique, and what works for one might not work for another. Therefore, the treatment of PCOS is typically tailored to your individual needs and circumstances. It's also worth noting that managing PCOS is not just about addressing the physical symptoms. The emotional and psychological toll it can take should not be underestimated. Counseling or joining a support group can be beneficial. Remember, it's okay to seek help, and it's okay to talk about what you're going through. In conclusion, managing and treating PCOS involves a combination of lifestyle changes, medication, and possibly surgery. It's about finding what works best for you and sticking to it. It's a journey, and like all journeys, it may have its ups and downs. But with the right approach and support, it's a journey that can lead to a healthier and happier you. Remember, it's important to consult with your healthcare provider if you think you may have PCOS.